This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, and we're going to be visiting the Women's Health Care Department. We're going to be speaking with Dr. Ed Hayes. He's a perinatologist. We're going to find out exactly what he does to help keep at-risk mothers and unborn babies healthy. Well, thanks for joining us today. Let's first start out by talking about what exactly a perinatologist does.
Well, a perinatologist is essentially an OBGYN that's gone on for extra training who limits his practice to high-risk pregnancies. Primarily, we deal with pre-existing medical conditions such as high blood pressure, diabetes, conditions that may develop during pregnancy such as gestational hypertension, and also fetal issues such as fetal anomalies, complications related to fetal growth and development, multiple gestations, twins, triplets, quads. That's primarily the coverage of the area.
Is it necessary that every pregnant woman see a perinatologist?
Oh no, it should be restricted to those who have a high-risk condition. Certainly, general OBGYNs are fantastic at caring for the routine obstetrical patient. As far as when's the best time to see a perinatologist, that really depends on, do you have a pre-existing medical condition? The classic example would be diabetes. Diabetes, uncontrolled prior to pregnancy, has a birth defect risk of 20% or higher. A well-controlled diabetic, where we may work with an endocrinologist to get their hemoglobin A1C, which is just a marker of their diabetic control, to less than 6 can decrease the rate of birth defects and anomalies to 3% or less. So you're talking about a 5-fold decrease, and that's beneficial. There are other medical conditions, lupus, high blood pressure. Epilepsy is another one that basically, with good control and minimizing the risk of teratogenic, which just simply means drugs that cause birth defects prior to pregnancy, we can substantially decrease the rate of birth defects and anomalies, as well as optimize maternal health. There's nothing worse for me as a perinatologist to meet someone, have to tell them their baby has an anomaly incompatible with life, and know that could have been prevented beforehand.
Right. Now, if a person thinks there might be a problem, would a person necessarily contact you right away, or do they work through their OBGYN?
All of my practice is referral, meaning basically it's something to bring up with their OBGYN before pregnancy, or basically during pregnancy if a problem develops. And usually their OBGYN will refer to someone like myself.
And why do you think Aurora is a little bit unique in terms of having services such as you offer?
Well, I think it's a coordinated care, and that's what being in Oshkosh is kind of one of our outreach satellites. It's a good place for me to meet a patient with issues weekly, but if a condition develops that requires hospitalization or delivery of an early infant at a very early gestational age, such as 24, 25 weeks, I also have the availability of a NICU in Green Bay. And where I think Aurora is unique in that is basically, number one is it has a board-certified perinatologist. Number two is it has a phenomenal NICU and NICU staff and outcome. And the third thing is I think Aurora's, when they were constructing the NICU, had the insight to put a 5th floor hospital hotel where patients whose babies are in the NICU have the opportunity to stay in the hospital, aren't told after 2 to 3 days, well, you don't live around here, you've got to commute 3 hours each way. Instead, the mom or dad or family members can stay in the hotel setting up on the 5th floor and basically be able to visit the NICU at any time during the day. Or if they're hospitalized during pregnancy and the family wants to stay up there, also, they certainly can stay up there.
Yeah, great services. Are there any new developments in your field that you're really excited about?
Well, I think probably the biggest thing is fetal surgery, fetal intervention. It's just been shown, for example, early diagnosis of spina bifida, one of the things we've heard about, having the spinal cord outside the body. Unfortunately, is a very difficult diagnosis to relate to patients. And we used to have to wait till after birth to intervene, but the fetal therapy network just basically published the hallmark study specifically looking at surgery in utero and basically repair of an meningeal, which is that open neural tube or that exposure of the spinal cord, will actually increase the likelihood of that child walking without assistance fourfold, from 10% to 40%, decrease neurologic deficits, and increase long-term outcome. So fetal therapy has really been hallmark, and basically it's just multiple interventions we're starting to be able to offer fetuses in utero that may have difficulties. The other issue is prenatal diagnosis. We've gone from the days of getting blood tests done and having to offer amniocentesis if there's a possibility, and now we can draw mom's blood directly and filter out fetal DNA that's circulating in the mom's blood and see whether or not definitively whether or not that baby is affected by things like trisomy 13, trisomy 18, or even something like Down syndrome, if the patient wants to know.
Yeah, it's an exciting field. There aren't very many perinatologists in the area. It's a very exciting field, and it's all about making babies healthy.
Yep, making babies healthy and keeping moms healthy.
Well, we appreciate you taking your time with us today.
Thanks.
Now, if you're in a high-risk group or you're having any trouble with your pregnancy, you should contact your OB/GYN and discuss the possibility of meeting with Dr. Hayes. Of course, if you have any other questions, you can certainly call us here at Aurora at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.